Okay, let's unpack this. Picture this. You're giving your pet a good scratch, maybe behind the ears, and you stumble upon something a bit worrying on their skin.
Hmm.
Maybe it's like a raw spot or a patch that feels kind of crusty and seems to be spreading, or maybe a sore that just isn't healing up. It can be really concerning.
Oh, absolutely. It's something owners notice pretty quickly.
So today we're doing a deep dive into what might be going on there, exploring this group of conditions known as erosive or ulcerative dermatoses in our pets.
And it's interesting, because erosion and ulcer sound kind of similar, but they describe different things happening to the skin.
Mhm.
And erosion is more superficial. It's just that very top layer that's broken.
Okay, just the surface.
Right. But an ulcer, that goes deeper. It involves like the epidermis, the outer layer, and the dermis underneath it. So a more significant break.
Gotcha. So the key thing, I guess, right from the start is that we're not talking about just one single disease here.
Not at all. It's a really heterogeneous group.
Yeah. Our exploration today, it's based on some pretty detailed medical info outlining these conditions, and it really shows just how varied this group of issues is.
Mm-hmm.
Our goal, really, is to understand the main categories of these skin problems, maybe touch on what could be causing them, and importantly, why figuring out the exact cause is so critical for, getting your pet the right help.
Definitely. And if we start with the why, like the basic pathophysiology, why these skin breaks happen, you immediately see that the reasons are incredibly diverse.
Yeah.
The actual processes going on under the skin really depend on the specific condition.
Right. So the end result might look somewhat similar, a break in the skin, but how it got there can be totally different.
Exactly.
The information we looked at points to some broad categories of causes. Like, one involves problems with how the skin cells actually connect to each other, sometimes congenital or developmental stuff.
Yeah, think of it like faulty Velcro or a zipper that doesn't quite mesh right between the cells. If those connections aren't strong, the skin is just more fragile.
Ah, okay. So even normal wear and tear could cause a break.
Precisely. It highlights how important that basic structure is.
Yeah.
Then there's a huge category involving the body's own immune system.
Right. This is where it gets kind of wild, where the immune system basically makes a mistake and attacks the pet's own healthy skin.
hmm And this can happen in a couple of ways. It might be a direct attack on the skin cells themselves. That's what we call autoimmune.
Okay.
Or it could be the immune system overreacting to some sort of trigger, maybe a drug or something else, and that causes damage. We call that immune-mediated.
So similar outcome, slightly different trigger mechanism.
Kind of, yeah. Both involve the immune system causing the damage, leading to those erosions or ulcers. It's fascinating, really, how the body's defense can sometimes turn on itself.
Yeah, it really is. Then we also have to think about damage from, the outside world,
Yeah,
external factors.
right, like trauma, getting cut or scraped, or exposure to harsh chemicals, burns, things like that. Even just persistent irritation.
So direct damage to the skin barrier.
Yeah, a more straightforward cause and effect compared to the internal immune stuff.
And of course, infections. Can't forget those. Bacteria, fungi, even parasites.
Absolutely. In those cases, the microbes themselves are actively damaging the skin tissue, maybe through toxins they release, or just by causing a whole lot of inflammation.
And that can range from just a surface thing to something really deep and nasty, I imagine.
Exactly. From a mild erosion to a deep ulcerating infection.
Okay, so that gives us a good framework for the why. Now, who gets these things? Is it mostly dogs or cats or...
The sources are clear. Both dogs and cats can definitely be susceptible. It's not really limited to one species.
And like with so many things in vet med, breed seems to pop up as a clue, right?
Oh, for sure. Breed predispositions can be really helpful hints. The research mentions things like certain lupoid disorders or familial dermatomyositis in collies and shelties, or even zinc-responsive dermatosis in huskies and malamutes.
Wow. So genetics plays a big part. It's like some breeds have a specific chink in their skin's armor.
That's a good way to put it. It can really help narrow down the possibilities when a vet sees a certain type of lesion on a particular breed.
Like putting puzzle pieces together. What about age? Does that matter?
It can, yeah. Some conditions tend to show up really young, like canine juvenile cellulitis puppy strangles, they sometimes call it.
Puppy strangles. Sounds dramatic.
It can look pretty dramatic. That and some congenital issues often appear in puppies or kittens, suggest something developmental or hereditary.
Okay, and others can pop up later in life.
Hmm? Many others can develop any time, even in older pets. which might point towards different kinds of causes that happen over time.
And the sources even mention sex playing a role sometimes.
Occasionally, yeah. It's less common, but for a few conditions there might be a slight sex predilection. These details, species, breed, age, sex, ovener, they don't give you the answer alone, but they're all valuable clues.
Right, helping build the picture.
Yeah.
Okay, so we know the why is varied and who might be affected. What about the what? What should you, as a pet owner, actually look for? What are the signs?
Well, the history you can give your vet is super important. Like, have you noticed your pet scratching like crazy?
Ah, the itch factor.
Exactly. Because sometimes the initial problem is something itchy, maybe fleas, or a superficial bacterial infection, pyoderma, or even a yeast infection, Malassezia. And all that scratching can actually cause the erosions and ulcers, self-trauma.
That makes total sense. They're just trying to get relief, but end up making it worse.
Precisely. And then you need to think about their environment. Any chance they got into harsh chemicals
Yeah.
or got burned maybe by the sun or something hot.
Or extreme cold, like frostbite.
Yep. Or even bites from venomous things like snakes or certain insects. All potential triggers.
And it was interesting that geography can play a role for some infectious diseases.
Yeah, that's a fascinating point. Things like Pemphigus or coccidioidomycosis valley fever or even feline cowpox virus, they tend to occur in specific regions.
So if you've traveled with your pet or live in one of those areas,
That becomes a really important piece of information for the vet. It's like medical detective work.
it really is. And you should also tell your vet about any other health problems your pet has, past or present, right?
Definitely. Because sometimes these skin issues are actually a sign of something bigger going on inside the body, a systemic illness.
Okay. So that's the history part. Now, when the vet actually looks at the pet, what kind of things might they see on the skin itself?
Well, the lesions can look really different. Sometimes it's just red, maybe slightly raw-looking areas. Those are typically erosions. Not much crusting.
Okay.
Other times you might see thick scale or crusts, and when you gently lift those off, you find an erosion underneath. So it's not always an obvious open sore right away.
So it can be kind of hidden.
Exactly. And the ulcers themselves vary too. Some are quite shallow, just affecting the surface layers. Others can be really deep,
Deeper how?
like sometimes they form draining tracts where pus or fluid is leaking out. Or they might look like little craters, cavitated lesions, we call them. Or be covered in this thick, sticky exudate and crust.
Wow, quite a range. And it's not always just the skin, is it? Sometimes the pet feels sick too.
That's right. Especially with some of the autoimmune conditions or more serious infections, the animal might also have a fever or just be generally unwell, lethargic, not eating well, malaise.
And you mentioned systemic links earlier, like liver disease sometimes showing up on the skin.
Yeah, there's a condition called superficial necrolytic dermatitis, often linked to liver disease,
Yeah.
or a type of pancreatic tumor. And there are others, like hyperioxanophilic syndrome in cats. It really shows how the skin can be a mirror sometimes for internal health.
A real window into their overall health. Okay, this is fascinating. We've got the why, the who, the what. Let's dig into the culprits now, those specific causes within the big categories. Let's start with autoimmune, the body attacking itself.
Right. So autoimmune diseases, the immune system mistakenly targets the skin. The sources list several, and often the type of lesion gives us a clue. For instance, Pemphigus foliaceus, that often presents with crusting and underlying erosion.
Okay, crusting and erosion. And Pemphigus vulgaris.
That tends to be more superficially ulcerative. Same for bullous pemphigoid and epidermolysis bullosa acquisita, often superficial ulcers. It kind of depends on exactly which layer or connection the immune system is attacking.
Makes sense. And there are different types of lupus, too.
Discoid lupus usually gives you erosive or maybe superficial ulcerative lesions, often on the nose. Then there's exfoliative lupus, seen more in German short-haired pointers, that's more scaling with erosion.
Okay.
Vesicular lupus, sometimes in collies and shelties, again, superficial ulcerative. And the rarer one, cold agglutinin disease, can cause really deep ulcers, often on the extremities, like ears and tail tips.
Wow. It's quite a spectrum just within that one category. Okay, what about immune-mediated? How's that different again?
So immune-mediated, the immune system is overreacting to a trigger, not necessarily attacking self-tissue directly in the same way. A classic example is a drug reaction, like erythema multiforme or the more severe form, toxic epidermal necrolysis, often triggered by meds, and they can range from erosive to superficially ulcerative.
Got it. What else falls under immune-mediated?
Vasculitis, inflammation, and blood vessels in the skin. That can cause ulcers from superficial to deep, sometimes even those crater-like ones. There's also idiopathic panniculitis, which is inflammation of the fat under the skin, usually deep, oozy, crusty ulcers.
Okay.
And a few others, like canine eosinophilic furunculosis of the face, might be linked to insect bites, often ulcerative and crusty, and that puppy strangles thing, canine juvenile cellulitis, that can cause erosive to superficial or even deep ulcers in young pups.
And cats have something similar too, right? The rodent ulcer.
Yeah, feline indolent ulcer or rodent ulcer, that can also look quite variable, erosive superficial ulcer, sometimes quite deep.
Okay. Now, infections. This is probably what many people think of first.
It's certainly very common, and here the microorganisms are directly causing the damage. We can sort of group them by type and depth. So surface bacteria, think classic hot spots, acute moist dermatitis, those are typically erosive.
Right, raw and weepy.
Exactly. And superficial staph folliculitis can also be erosive or cause small superficial ulcers. So superficial means mostly surface damage.
And when it goes deeper?
Then you get things like bacterial folliculitis and furunculosis,
Mhm.
basically infected hair follicles that rupture. Those often lead to deep ulcers, maybe crusted, sometimes with draining tracts.
Draining tracts sound unpleasant. What about fungi?
Similar idea. Superficial fungi like Malassezia yeast or dermatophytes ringworm usually cause erosive to superficial ulcerative lesions, maybe some crusting or scaling.
Okay.
But then you have the deep fungal infections, sportricosis, crypto, histo, blasto, kochi. These guys can cause nasty, deep ulcerative lesions, again, sometimes with draining tracts. Much more serious, often systemic involvement, too.
So deep really means it's invaded further into the tissue.
Pretty much. And there are other less common but important bacteria, too, like opportunistic mycobacteria or actinomycetes, which also tend to cause deep ulcerative nodules and draining tracts.
It sounds like those draining tracts are a real red flag for a deeper infection.
They often are, yeah. Definitely warrants investigation for deeper bacterial or fungal causes.
The sources also mention some other infectious agents like pethiosis and leishmaniasis.
Right. Less common overall, but critical in certain areas or with travel history. Pethiosis and legioniosis, and also protothecosis, those can cause these weird ulcerative, proliferative lesions, almost tumor-like sometimes, often with draining tracts too.
Wow.
Leishmaniasis, usually spread by sandflies, can look like anything from erosions to deep ulcers. And then viruses, feline cowpox, can cause deep ulcers.
Right.
FLV or FeLV-related skin disease can be erosive or ulcerative, and feline herpes virus can cause ulcerative dermatitis, often with crusting, especially on the face.
Man, that's a lot of infectious possibilities. What about parasites? We know fleas and mites cause itching.
And that itching, as we said, can lead to self-trauma erosions and ulcers, but parasites themselves can also cause direct damage. Demodex mites, especially if there's secondary bacteria, can lead to ulcerative, crusty lesions. Sarcoptic mange in dogs, notoedric mange in cats, intensely itchy, often results in erosions and crusts from scratching. Flea allergy dermatitis, again super itchy, can become erosive or ulcerative, especially with secondary infection.
Makes sense.
Cats can get mosquito bite hypersensitivity erosive to deep ulcers, usually on the ears, nose, paw pads, and even some migrating worms like Pelodera or hookworms can cause deep ulcers where they emerge from the skin.
Good grief. Okay, shifting gears slightly. What about conditions animals are born with, congenital or hereditary stuff?
Yeah, sometimes the skin is just inherently fragile or prone to issues, like canine familial dermatomyositis in collies and shelties that causes erosions. Epidermolysis bullosa is another one where the skin layers don't adhere properly, leading to easy blistering and superficial ulcers.
So the skin itself is just weak?
Essentially, yes. And related is cutaneous asthenia, or Ehlers-Danlos syndrome, where the skin is super stretchy and tears incredibly easily. Not exactly erosive, but a fragility issue.
So it's not always an attack on the skin, but sometimes the skin itself is the problem. What about metabolic diseases, internal problems showing up externally?
Right, problems inside can definitely affect the skin. We mentioned superficial necrolytic dermatitis, often linked to liver disease or a specific pancreatic tumor, usually presents with crusting and erosion, often on the paw pads and around the mouth.
Okay.
Hyperadrenocorticism, Cushing's disease can lead to thin skin, and if they get secondary infections or calcinosis cutis, you can see erosions or ulcers. Even severe kidney failure, leading to uremia, can sometimes cause ulcers, especially on the gums or tongue.
A real reminder of that interconnectedness. Now, the tough one, cancer. Neoplastic causes.
Unfortunately, yes. Skin tumors can definitely become erosive or ulcerated.
Yeah.
Squamous cell carcinoma is a common one, often looks eroded or ulcerated with scale or crust.
Right.
Feline squamous cell carcinoma in situ or bonoid carcinoma looks similar. Mast cell tumors can ulcerate, sometimes quite deeply. Epitheliotropic lymphoma, the type of skin cancer, often causes erosions or superficial ulcers.
Are there others?
Yeah, a couple of rarer sort of secondary things. Feline thymoma-associated exfoliative dermatosis. A tumor in the chest causes scaling and erosion all over the body. And feline perineoplastic alopecia, where an internal cancer causes the hair to fall out easily, sometimes leaving erosive skin.
A stark reminder that any non-healing sore needs checking out. What about nutrition? Can diet cause these issues?
It certainly can. Zinc-responsive dermatosis, mostly in Arctic breeds, causes crusting and erosion, typically around the mouth, eyes, and pressure points, and it responds to zinc supplements.
Okay.
And some dogs can develop what's called generic dog food dermatosis, basically a reaction or deficiency related to lower quality food, also causing crusting and erosion.
Interesting. Diet matters. What about physical stuff, like body shape or pressure?
Definitely. Pressure sores deep ulcers over bony bits like elbows or hips in dogs that lie down a lot. Intertrigo or skin fold pyoderma, that's the inflammation and erosion you see in skin folds like on wrinkly dogs where moisture gets trapped.
Yeah.
And again, self-trauma from any itchy condition falls here too. The dog or cat causes the erosions or ulcers themselves through licking, biting, scratching.
And sometimes we just don't know, right? The idiopathic category.
Exactly. Despite all the tests, sometimes a clear cause isn't found. Examples include feline dorsal neck ulcer, just what it sounds like. Canine and feline acne can sometimes get bad, become erosive or ulcerative with secondary infection. And feline plasma cell pododermatitis, swollen, sometimes ulcerated paw pads in cats.
Okay. And lastly, a miscellaneous category for other external injuries.
Yep. Basically covers direct physical or chemical insults. Burns thermal, electrical sun, chemical, frostbite, contact with strong chemical irritants, and venomous bites against snakes. Spiders often cause deep ulceration and tissue death, necrosis.
Wow. Okay, that list is incredibly comprehensive and honestly a bit daunting. It absolutely hammers home why getting an accurate diagnosis is job number one.
It really does.
So after hearing all that, you might be thinking, how on earth does my vet figure out which one of these it is? Let's get into that detective work, the diagnosis.
Exactly. Unraveling the mystery. And given that huge list we just went through, the history you provide in the vet's physical exam are incredibly important first steps.
Because the details matter.
Immensely. The sources stress that subtle differences in how the lesions look, where they are, how they started, how quickly they progressed, all these details are vital clues. Paying close attention to the character of the lesions, the distribution pattern, it helps narrow things down.
Gathering those initial puzzle pieces, what about general lab work? Blood tests, urine tests?
They can be useful, especially if the vet suspects an underlying metabolic issue, or if the pet seems systemically unwell, feverish, lethargic. It helps assess overall health.
Okay. But for the skin specifically, what are the go-to tests?
Well, several procedures help pinpoint the cause. Skin scraping is often done early on to look for mites, like Demodex or Sarcoptes.
Right, check for parasites.
Then there's cytology. That can be done by pressing a slide directly onto the lesion, an impression smear, or by sticking tape to the skin, or swabbing. That lets us look under the microscope for bacteria, yeast cells, inflammatory cells, and sometimes specific diagnostic cells like acantholytic keratinocytes in Pemphigus.
Ah, okay, looking at the cells directly.
Yep. If there are nodules or lumps, a fine needle aspirate sticking a small needle in to get a cell sample is helpful for cytology too. And cultures are often key, especially with ulcers or draining tracts.
To find out exactly which bacteria or fungus is involved.
Exactly. Bacterial culture and sensitivity tells you what bacteria are there and which antibiotics should work. Fungal culture helps identify dermatophytes or deeper fungi. Sometimes special cultures for mycobacteria are needed too.
Makes sense. Are there blood tests for specific infections?
Sometimes. Depending on the suspected disease and location, fungal serology looking for antibodies in the blood, or specific tests for things like pemphigus or leishmaniasis might be useful. And for feline herpes dermatitis, specialized tests like PCR or immunohistochemistry on biopsies can help.
Sounds like a lot of tools in the toolbox, but the sources really seem to emphasize one test as being often the most helpful, right?
Absolutely. Skin biopsy for histopathology. That's generally considered the gold standard for many of these complex cases.
Why is it so informative?
Because it gives us a look at the actual tissue architecture under the microscope. A pathologist examines the layers of the skin, the pattern of inflammation, any changes in the cells or structures. This can reveal characteristic patterns for many autoimmune, immune-mediated neoplastic, and even some infectious or hereditary conditions that you just can't diagnose otherwise.
So it shows how the skin is damaged, not just that it's damaged.
Precisely. Taking good samples is key, usually from the edge of ulcers, or multiple samples including normal skin and lesions at different stages for more widespread issues.
Okay, biopsy is key. What about imaging, like X-rays or ultrasound? Is that often needed?
Less often for the skin lesion itself, but it can be really important in specific situations, like chest X-rays if you suspect a deep fungal infection might have spread to the lungs,
Ah,
or X-rays or ultrasound if you suspect feline thymoma-associated disease, or maybe an abdominal ultrasound if you're looking for liver disease with superficial necrolytic dermatitis, or an internal tumor causing perineoplastic alopecia. So it's more for investigating potential underlying systemic causes or spread of disease.
got it. Okay, so we've figured out, hopefully, what's causing the problem. Now, treatment. Given the massive list of causes, I'm guessing treatment is not one size fits all.
Not even close. You're absolutely right. Treatment varies hugely depending on the specific diagnosis. It has to be targeted to the underlying cause.
But are there some general supportive things that help most pets?
Oh, definitely. Supportive care is often crucial. Keeping the lesions clean, maybe using specific shampoos or topical treatments, preventing self-trauma with e-collars or other methods. And pain management is really important. These conditions can be very uncomfortable.
Makes sense. Do they usually need rest?
Generally, activity restriction isn't needed unless there's maybe a zoonotic risk of disease humans could catch, or if movement is painful.
And diet. Does that play a role in treatment?
It can. Some pets might need nutritional support if they're really debilitated. For generic food dermatosis, obviously changing the diet is key. And for zinc-responsive dermatosis, zinc supplementation is the specific treatment.
Right. And educating the owner seems important too.
Hugely important, especially understanding the condition, the treatment plan, expected follow-up, and crucially, any zoonotic risks. Surgery also has a role sometimes, right?
Yes. For specific things like removing that thymoma tumor or certain skin cancers or maybe debriding really severe infected wounds or abscesses. But the absolute number one most critical point about treatment seems to be,
Get the diagnosis right first. Absolutely imperative.
why is that so critical again?
Because the treatments can be diametrically opposed. Think about it. Autoimmune diseases often need immunosuppressive drugs. But if you give those drugs to an animal that actually has a deep fungal infection,
Oh, wow. That could be disastrous.
exactly, it could allow the infection to run rampant, potentially fatally. So you cannot treat based on assumptions. You need that definitive diagnosis.
That is such a crucial takeaway. Know the enemy before you choose the weapon.
Well put. And then, of course, monitoring is key, watching for improvement, but also for any potential side effects of medications, especially if they're on things long term.
Right. What about prevention? Can we stop these things from happening?
It really depends on the cause. For some infectious diseases in cats, keeping them indoors reduces exposure risk. For conditions triggered or worsened by sunlight, like some lupus forms, limiting sun exposure helps. But for many others, especially autoimmune or hereditary ones, prevention isn't really possible. It's more about early diagnosis and management.
Okay, so tailored prevention where possible. Finally then, what's the outlook? What can people expect long term? Prognosis, potential issues?
Again, it all comes back to the underlying cause. The prognosis is entirely determined by what disease has been diagnosed.
So some are curable, some are manageable, some are less optimistic.
Pretty much. Some infections can be cured with the right treatment, though sometimes long courses are needed. Others, especially deep fungal ones, might be managed, but maybe not fully eradicated. Some autoimmune diseases require lifelong management.
And the sources mention pethiosis having a poor outlook.
Yes, extensive pethiosis or ligeniosis, unfortunately, often carries a very poor prognosis despite aggressive treatment attempts. It's also important to remember some of these diseases can be life-threatening, and some, as we mentioned, have zoonotic potential.
Things owners need to be aware of.
Definitely. And for pets needing long-term immunosuppression, there's always that ongoing risk of secondary infections or medication side effects that need careful monitoring and management with the vet.
So it's a complex picture, requires real partnership between the owner and the vet. Okay, to wrap this up then, it's abundantly clear that erosive and ulcerative dermatoses in our pets aren't simple. It's this really complex, diverse group of conditions.
Mm.
And while we've covered a ton of information today, hopefully giving you a better understanding, it's absolutely essential to remember this is informational. If you see any kind of concerning skin lesion on your dog or cat, something raw, crusty, non-healing, please get in touch with your veterinarian promptly.
Early and accurate diagnosis is truly key for the best outcome.
Absolutely. It's the only way to figure out the right treatment plan for your specific pet.
And, this whole deep dive really highlights something interesting, how the skin, which we often just see as, an outer covering, can actually reflect such an incredible array of things happening both inside the body and from the external environment.
That's a great point. It makes you wonder, doesn't it? What other seemingly simple things we observe about our pets might actually hold deeper clues about their overall health and well-being? Something to think about.